Here is tip number 7 for those of you having babies soon. Now, not everyone wants to breastfeed, granted, and that's totally okay. As midwives, we're there to support you no matter how you want to feed your baby. If you're bottle feeding, then just make sure that you are equipped in how to make up a feed safely before you go home, and also how to sterilize your equipment at home. Those are two really important things. Now, there's lots and lots of sterilizers at home, so just make sure to read the manual for your sterilizer before you take your baby home. There's microwave ones, there's ones that have got Milton solution, things like that. There's loads and loads of different ones out there, so just make sure you are 100% A-OK with your chosen method. Now, if you're breastfeeding is tricky, right? It's not as simple and straightforward and natural as what it seems to be. You just think the baby's born and then it's just gonna automatically know what it's doing. Sometimes babies do, and other times babies don't. And sometimes your breastfeeding journey can get off to a really great start, and other times it's a little bit of an uphill struggle. Now, it's really important throughout all this process to try your best, and this is really, really hard for me to say, but try your best to stay relaxed, because you need the oxytocin flowing, which is the love hormone. And if you listened to my other points before, you will remember that oxytocin, which is the love hormone which helps to bring out the milk, is also inhibited by cortisol, which is the stress hormone. So try your best to stay relaxed as much as you can, because that will hopefully allow for the letdown. Now, we do know that there are some women that come through time and time again with their first baby, subsequent baby, and they suffer with a lack of milk supply. Now, that is one problem out of a multitude of problems. There's other ones, like babies can sometimes be allergic to milk. There's so many out there, but what I would suggest is if you are having trouble, have a little look into your neighbourhood breastfeeding groups, because they are really, really excellent. You can take your baby along, it might be on a Tuesday or Wednesday morning or whenever, and you can bring your baby along. You can basically troubleshoot with lots of breastfeeding support specialists who have done this job for many years, and most people find that really, really helpful. So take a little look at your neighbourhood breastfeeding groups, and also there are lactation consultants that will come to your house, but they do generally tend to charge a fee, so that could also be an option for you if you haven't got a neighbourhood group in your vicinity.